Okay guys, welcome to the video. Today I'm going to show you an exercise. It's a mobility exercise for the hips. It's specifically to help improve being able to flex our hip. Okay, so obviously you see that I'm flexing at the hip here. This is the same thing. If I gotta move my torso down, I'm still getting the same flexion at the hip here, but sometimes we'll run into some issues with our patients where they have either just lack of mobility, and that's important because they might present with some other things, maybe some knee pain or low back pain, and one of the main drivers or causes of that could be functionally they're not moving well in this plane at the hip. So other times they'll actually present with maybe some pinching in front of the hip as well. Most likely they may have some hip impingement, which sometimes can actually be structural. The hip joint doesn't move well, but even that's more reason to be able to show some really good ways to keep that hip mobile, because they're at a little bit of a disadvantage because of that structural change. But other times they can get some hip impingement just from more of a mechanical reason. They might be tight in a couple places, and we need to show them how to move that. Okay, so we're gonna go right into it here. So what I'm gonna do is, this is what we do with our patients. We have them start right on all fours. Okay, they get their hips just a little bit wider than hip width, and that's something that can actually be played with a little bit as they attempt to do this. Something else that they got to pay attention to too is where their feet are in relationship to their hips, because as you can see, when I move my feet, I actually rotate at the hips. We start them really rotated in at the feet, which is rotated out at the hips. So this is typically our start position. So all we're going to do from here is we're keeping our back straight. We're going to dip our hips down so our butt goes towards our feet, and we come back up. So we're just going to repeat this motion. And this should feel relatively easy for most people. And so what we're doing here is we are obviously working on moving that hip. We are rotated out at the hip, which gives a little bit more freedom. So they can start with a few repetitions here. They can play with that motion a little bit. They're avoiding any pinching at the hip. If they feel it, they may need to shorten that motion a little bit, or maybe bring their feet back in a little bit. But this is where they want to be. Okay, and we'll have them repeat this. A typical recommendation might be 8 to 10 times, and we'll have them do this before activity, or we might have them do this as part of a regular routine. Okay, now after we hit about 8 to 10 repetitions of that, we want to continue on here. But what we're going to do is we're actually going to rotate our body, dropping this pelvis down. And the easy method is just we have them drop that arm kind of midline here. Okay, so we're still working that same plane, but as I do that, I start to open up this opposite hip here. So I'm pointing towards my adductor kind of groin area here, okay? So as I do this, I'm gonna be doing the same motion, same thing. My low back is straight, I'm just driving that hip back. I'm not feeling any pinching in the front of the hip, but the only difference I feel this time is I do get a nice good stretch on the inner thigh adductor muscle, okay? So I'm gonna do about 8 to 10 of these, and then I'm going to reverse and do the same exact thing. So now I'm going to get a little bit more stretch on the inner thigh muscles on the right side, and we're going to repeat that about 8 to 10 times. And that's the method. So one more time, we go 8 to 10 here, no pinching. We drop down. I'm going to work on that left side 8 to 10 times, and then I'll switch, finish off here. So again, we'll give that to somebody who needs that mobility. We might give it to some other people that maybe we'll incorporate into their warm-up if they're trying to do some squatting, because again, they might need a little bit more freedom here. But what we want to see ultimately is that they have as much motion that allows into that hip without continuing to cause any anterior or any pain in the front part of the hip, and also want to make sure that just overall they have really good motion at that joint. So that's all we got for you today. Let us know what you think. If you got any comments, you got any questions, please make sure you let us know, and we'll talk to you next time. Thanks.